Patients who are planning a breast augmentation or who are planning a breast surgery that involves breast implants ask questions about the safety of silicone, and I think that's an important thing for us to talk about. Silicone breast implants are something that's been around and been used for many years. So I'd like to talk about the history of silicone breast implants, and I'd like to talk about what's inside of them, and let's talk about the safety studies that support the decision to use them in cosmetic breast surgery. Silicone breast implants were first used in 1962 and by Cronin and Giroux, and they were designed in partnership with Dow Chemical Company as a device that can be placed inside of the breast in order to create a soft and augmented breast for patients desiring larger breasts. Those could be used for patients desiring too larger breasts or for patients who have an asymmetry in the breasts. But what they were designed to be is a silicone scar pocket or bag that's filled with a soft silicone substance. So Dow Chemical suggested that they use a liquid silicone substance, which was soft and pliable and inert to the human body or not reactive. The first silicone breast implants were placed in patients, and they were very popular. They took off, and those were used for a number of years. And since the 1960s, there have been 5 generations of silicone breast implants used for breast augmentation. Early breast augmentation implants were filled with a liquid silicone, a thin oil, which, if they ruptured, could leak into the scar pocket inside of the breast. Or if that scar pocket was cracked or ruptured, that liquid silicone could escape into the surrounding tissues, and the body might react to that by creating a granuloma or a foreign body reaction around that silicone. Anytime there's a foreign device inside of a person's body, the human body will create a scar pocket or a wall around that device, whether it's a hip replacement or a pacemaker or a breast implant. Your body will create a wall of scar around that device. A breast implant intact inside of the breast creates a scar pocket around it, and we call that a capsule. But if silicone leaks out of that scar pocket into the tissue, then the tissue will react to it, creating a granuloma or a scar pocket around that liquid silicone. And that's a problem because if there's a leak of silicone into the scar pocket, or worse, into the surrounding tissue, it can create palpable lumps or bumps in the breast, which of course any patient finds concerning. So when we're revising or removing a ruptured silicone breast implant, it's important to do an en-bloc resection of the scar pocket and the ruptured breast implant to remove all of the liquid silicone material from the breast. So let's talk about the safety of breast implants and the modern breast implant. When breast implants were first put onto the market, breast implants were used for patients, manufactured and placed by surgeons, but there had not been safety studies done to determine the safety of those devices. The FDA came into being after the invention of breast implants. So by the time 10 or 20 years had gone by and patients had breast implants for all of those years, there were patients who developed conditions like arthritis or pain, and they would say, well, it might have been caused by my breast implants. Nobody knew if that was true. And so breast implants were removed from the market in order to collect true evidence-based scientific data to look at a correlation. Is there a cause and effect relationship between the presence of a breast implant or the rupture of a silicone breast implant and the development of pain conditions, of immune disorders, of pain and other problems in patients? Some of the best studies that gave me the most comfort in the use of breast implants were designed and done in Scandinavian countries because they have a unified health system with 98% or more participation by the public, and a high percentage of patients in those Scandinavian countries undergo breast augmentation. So here you have, there in the 1990s, when breast implants were removed from the market because they didn't have data to say they were safe or weren't, and so the FDA removed those implants from the market. And studies were designed and done in those Scandinavian countries to look at the safety of breast implants. They have many patients in those studies, thousands and thousands of patients, followed over 10 and 20 years to look at the safety profile of silicone breast implants. And in those studies, what they found is that silicone breast implants and saline implants had the same safety profile, the same risk of depression, of chronic pain, and of other disorders of connective tissue like fibromyalgia, lupus, and other disorders. And what those studies found is that patients who had any type of breast implant, whether saltwater filled or silicone oil filled or silicone gel filled, had the same risk of developing connective tissue disorders, chronic pain disorders, fibromyalgia, arthritis, and other systemic problems that were in question as to whether they were caused by silicone breast implants. So prospective studies were designed and conducted in the Scandinavian countries, which were the perfect environment for developing these studies because they have a unified health system in which 98% of patients participate in the government health program. So when a patient changes doctors, their health record follows them. And so you don't lose patients to follow-up. In America, if you go see a plastic surgeon and you don't like your result, you might go to a different doctor and they have a different medical record and you're lost to follow-up. But in the Scandinavian countries, when you change doctors, your medical record follows you. So a scientific study looking at the safety and the long-term complications of breast implants, a study done in a Scandinavian country, has an excellent accuracy rate for looking at the long-term complications of those medical devices. And what they found in those Scandinavian studies is that patients who had a saltwater-filled implant had the same risk of developing complications as those who had a silicone oil implant. The risks of chronic pain, of joint pain, of fibromyalgia, and other connective tissue disorders was no different between the saltwater implants and the silicone oil implants. And they looked at those patients at 10 and 20 years. And so what's important to know is that any patient who has a breast implant, whether saltwater filled or silicone oil filled, has a similar risk, no difference, in the risk of developing those complications. Patients who had no augmentation at all had a slightly lower risk of depression. When I'm taking care of a patient who's having cosmetic surgery, I'll often think of them as a sister or a family member. Is this something I would do for my sister? Does this pass the sister test? And so ultimately, I'll tell you, silicone breast implants at this time, based on the prospective, well-designed, long-term studies looking at silicone safety, these silicone implants pass the sister test. I think that silicone breast implants are a fine choice for breast augmentation, especially good for patients who have thin tissues or who are having breast reconstruction with a thin skin envelope covering the implant. Silicone breast implants, in my opinion, are the best choice.